At this time, approximately 11% of prevalent ESRD patients receive dialysis at home. Hi, my name is Dr. Lauren Stern. I'm an assistant professor at the Boston University School of Medicine in the renal section.
Dr. Stern, you recently wrote the article titled Time to Expand Access and Utilization of Home Dialysis, Lessons from the COVID Pandemic. What do you want the reader to take away from this article?
I would like readers to understand that we are significantly underutilizing home dialysis therapies in the United States. We do know that patients who are on home dialysis have a better quality of life and also have more independence. So even prior to the pandemic, I think it was very important for people to understand that we should expand utilization of this procedure. Now, in light of the pandemic, I think it really highlights the differences between dialyzing at home versus dialyzing in-center at a dialysis unit. One of the things that it really shows us is that dialysis units, in-center dialysis units, are very crowded places with many patients. Some units have up to 50, 60 patients. Then you also have all of the techs, the nurses, social workers, dietitians, physicians that care for the patients, and having so many people on top of each other in a situation where they can't socially distance will put these patients who are immunocompromised at further risk of infectious disease like COVID-19. So it's really difficult because these patients have to come to dialysis at least 3 times a week in order to treat, and it is life and death for them if they miss their treatment. So I think that in light of this pandemic, dialyzing at home really does help to mitigate your risk from catching COVID-19.
What do you think the next steps are to bring this vision to fruition?
So my dream for home dialysis expansion is to be able to get access for patients that otherwise would be unable to do dialysis on their own. This includes groups of patients who are medically frail, and perhaps don't have a caregiver to assist them with dialysis. And if Medicare would have the ability to fund people who could come in to hook patients up to dialysis, I think that that would really give many more patients an opportunity to do this modality at home. As it stands right now, either the patient themselves or a caregiver who is unsupported will have to help them, and this really does require intensive training and on their part and time. So I think that really having the ability to have a person come into the home to hook the patient up to dialysis and having this covered by insurance would really give patients the ability to do dialysis at home. Thank you so much.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.